Hi everyone, Dr. Ian here and
Dr. David.
We are from Australian Health Hunter Valley, and today we are going to talk to you about traumatic brain injury and chiropractic care. Now, did you know that there's a lot of people who has had traumatic brain injury? Now, the severity of it may be from mild to severe, but if you've played sports in some ways or another and you've had a knock and bumped your head against something, and most likely it could actually cause an injury into the brain, and you may not realize it, but it can really change the way your brain and body works, so the neurology of the body.
Can I add on top of that? Even kids, they're tumbling around, just sometimes fall over from the couch or from the bed, that can actually give your brain a little shake. That's right. In there too.
Now, in kids and teens alone, there's about 170,000 annually of kids and teens who would have had some form of brain injury. And in terms of adults as a whole, 450,000 Australians are suffering from brain injury, and 3 out of 4 of those are people under the age of 65. So that's quite a lot of people, and of course there's different severity, as I've said before. Now, there's more of a greater awareness as well in terms of the effect, the neurological effect of brain injury. And for example, for athletes who have suffered from brain injury, there's a likelihood of them for re-injuring. They would have had some lower processing ability, and therefore, for example, slower reaction time, and they're not as sharp anymore. And then they would have also be more at risk with having an early onset of Alzheimer. And then there are other post-concussion syndrome that may come along as well. So a lot of it affecting the eyes, for the ocular motor reflexes and the different things. For example, the ability to focus on an object, or to follow an object, and also just how their ability to sense themselves in space, or like how far away is it. So if you think about sports, is the ball coming and how far is it? Do I need to get ready now or give a bit more time? So that will really play a part in that. And there's a lot of other things that is quite technical, but and also affecting balance too. So vestibular ocular motor reflex. So in all of us right now, as I'm talking to you and as Dr. David is standing, there's an involuntary eye movement that actually helps us to keep balance. So if you've had a head knock, that could be affected, and perhaps that's why you feel a bit wobbly and a bit dizzy and so on. So there's so many things, and you're going to add a few and show a few things. Yeah.
Absolutely. So whilst these symptoms can be experienced by many people, and in clinic we test these symptoms in a more I suppose a clinical way, so we can be standardized, and we can say, oh, okay, well there might be a bit of symptoms going on in here. So there is a research we have. In this research, there are about 40 Australian adults, and they have been suffering from symptoms, post-brain injury symptoms, for a long time, and they've been randomly selected into 2 groups, one being a chiropractic group, the other one is a control group, and they were tested for some of these visual related symptoms. And Dr. Ian and I are going to demonstrate some of these tests that we're going to do. So one of them being saccades. So what we're trying to do is to get someone to focus on one finger here, and we're going to switch to the other one and back onto the other one and back here. So we're looking at whether if that person are able to focus on that finger, whether if there is a bit of delayed in there as well. Now we can also go up and down. Just go up and down and up and down. Great. Now this is being one of the tests, and there is another test that is actually looks quite funny to do. So this one is a vestibular ocular motor reflex. So what we're trying to do is we'd get the patient to look at, for example, my eyes or my nose, and we're going to move their head. And what normal is, I'm going to move your head now. Is it okay? Yes. So I'm going to move this way. So we can see Dr. Ian's eye is actually locked in my nose. And when we go the other way, we can see that as well. But then if following a concussion or potentially a brain trauma, we can potentially see these eyes are not fixating properly into my nose, for example. So as a result, in that research, the people who receive chiropractic care has way better results compared to the control group. So whilst this is a small sample size, right, but the result is actually quite promising. So we need bigger sample size, we need more people to be involved in this research for us to really look into, hey, whether chiropractics is the way to go. But then so far it's actually quite promising. So if you or your kids are suffering from any of these symptoms, whether if there are a bit of spatial awareness problems, you bump into things without any reason, or start doing it after an injury, then it might be a good idea to have a chat to one of our chiropractors and see whether we can help you manage those symptoms.
Yep.
All right.
All right.
Everyone stay safe. Have a good weekend.
Bye.